Good morning. My name is Dr. Giri Babu, working as a senior lecturer in the Department of Physiology, Faculty of Medicine, University of Malaya, Kuala Lumpur, Malaysia. This is the microlearning video. In this video, I try to explain different phases of ovarian and uterine cycle. What is ovarian cycle? Ovarian cycle indicates the state of follicle with the influence of different hormones. It can be divided into follicular phase, ovulation, and luteal phase. Next one is uterine cycle. Every month, uterus will be changes will be occur on the especially on the endometrium with the help of hormones. It is very important for the fertilization and implantation. This is called like a uterine cycle. It can be divided into proliferative phase, secretory phase, menstrual phase, other also we call like a pregnancy. The uterine cycle 0 to 7 days we consider as a menstrual phase. In this phase, bleeding will be occur. It means the shedding of uterine lining or endometrium will be occur during menstrual phase. Day 17 to 14 days we consider as a proliferative phase. So, following menstrual phase, the proliferative phase begins. With the help of estrogen, it will be stimulating the endometrium so that the thickening will be happen, the regeneration of the blood cells will be happen. It is very important for the prepare the uterine implantation. Next stage we call like a day 14 to 28 we call like a secretory phase. In this secretory phase, so mainly on the day 14, ovulation will be occur. So it indicates after ovulation, the follicle will be changed into the corpus luteum so that the progesterone will be released by the corpus luteum. So in this phase, proliferation is very high. So the uterine lining also increase further increasing their size and blood vessel also increasing their size and number also. It is very important for the fertilization of and implantation. If fertilization will be occur, this it will be continue of the further development of the uterus. If there is no fertilization, so the shedding will be happen. We start the menstrual phase. Next one is ovarian cycle. 0 to 14 days we consider as a follicular phase, and day 14 to 15 we consider as a ovulation, and day 15 to 28 we call like a luteal phase. So look at there 0 to 14 days due to the influence of follicle stimulating hormone and luteinizing hormone. So follicle stimulating hormone and luteinizing hormone released from the anterior pituitary, it affect on the follicles so that the growth of the follicles will be happen, especially primary and secondary follicle will be formed. So from there, one follicle will be changed into the graphial follicle. That graphial follicle releasing the estrogen also, because the estrogen earlier we discussed, it is very important for the preparation of the implantation. So on the day 14, luteinizing hormone will be suddenly rising, so it will be reaching to the peak. So day 14 to 15 we call like a ovulation phase. When the luteinizing hormone will be increasing so that LH surge will be we call like LH surge. So the ovulation will be occur on the day 14. Then day 15 to 28 we call like a luteal phase. Once the ovum or egg will be released, the follicle will be changed into the luteal phase. So it is formed like a corpus luteum. In this corpus luteum, progesterone will be secretion will be happen even though estrogen also, secretion also little bit occur. If there is a fertilization will be occur, so implantation will be occur, so corpus luteum will be continue. If there is no implantation, corpus luteum will be changed into the corpus albicans. Finally, it will be shedding out. So the new follicles will be development will be start. So now we move to the interactive question. The first question is during which phase of the ovarian cycle does the Graafian follicle develop? So, which one? So, next one is what happened to the corpus luteum if fertilization does not occur? So, first one is answer is during which phase of the ovarian cycle does the Graafian follicle develop? Answer is follicular phase. Next one, what happened to the corpus luteum if the fertilization doesn't occur? So, so answer is C, it degrades and ceases and hormone production. These are the reference videos and reference books. If you have any doubts, please refer these books and videos. Finally, thank you for your attention.